Hey guys, welcome to our Friday Facebook Live. Let me just get the camera angle a little bit better. There we go. If you hear my dog barking in the background, I'm sorry, and you can see I'm not at my office today. With the power outage, our phones and computers are down, so I'm working from home. But I didn't want to miss our Friday Facebook Live, and today I'm going to talk a little bit about how Botox works. So I think so many people realize that Botox stops wrinkles, but they don't know exactly how it happens. Botox is actually a neurotoxin. It acts between the nerve cell and the muscle, and it stops the communication between the two. So essentially it paralyzes the muscles. This makes it work well in the upper third of the face because most of those wrinkles are caused by motion. I would love to demonstrate by frowning or smiling, but my face is Botox, so it doesn't really move. And that's where it's most effective. Around the mouth, those lines are really caused by tissue dropping with gravity, so filler is a better option there. You also don't want to do Botox around the mouth necessarily because it can cause problems eating or speaking. So there are a few different neurotoxins on the market. There's Botox, which has been around the longest. There's Xeomin, which is fairly similar. And then there's Dysport. I don't use Dysport, so I can't really speak to that, but I do use a lot of Botox and Xeomin, and they're fairly interchangeable. It takes the same number of units, which is just our arbitrary way to measure it. They both take about 5 to 7 days to kick in. So initially you won't see anything happen, and then over that week, you'll find that you can't frown or raise your eyebrows. They also both last about 3 months. The first few times you get them, they may not last that long, but as your muscles weaken, they'll last a little bit longer. Now, if you have wrinkles that are there, even if you're not frowning, those will still be there. Those are called static rhytids, meaning they're there at rest. Over time, your skin will actually remodel. So don't be dissuaded and think, oh, Botox isn't going to help. It won't get rid of the wrinkles immediately, but over time, they will soften. I love doing Botox or Xeomin really when lines are just starting. So when you just see a little permanent crease forming, that's the right time to get them because you can prevent those lines from getting deeper. Now, another quick word of advice, if you're interested in getting a neurotoxin like Botox or Xeomin, go to a board-certified plastic surgeon, dermatologist, or facial plastic surgeon. And that's an ear, nose, and throat doc who has had extra training in cosmetic surgery. Those are the people who are trained to do Botox. It's fine to see a nurse injector at one of their offices. I have a fabulous nurse injector, Val Greer, but she's under my supervision and she's been vetted by me and she does my own treatment, so I know she's good. I wouldn't recommend going to a doctor who's trained in another specialty. We're trained differently, we understand the facial muscles and nerves, and we know how to fix problems, and we have other treatments to offer. It's not just a one-stop shop for Botox. If you are interested in Botox or filler, you can check out my webpage. I'll put a link in the comments. And consultations for Botox and filler are always free. You can call us at 440-974-8577. Take care, and I'll see you next week.